We know that the holidays are over now, and perhaps while you were visiting family during that time, you might have noticed some changes in mom, dad, perhaps another relative, especially with their memory or behavior. And this is something that you really need to talk about. If that journey leads to an eventual diagnosis of dementia or Alzheimer's, one of the things that you need to do is plan for how much this disease is going to cost.
So my dad was a very successful orthodontist in the city of Edina.
It is every family's fear.
He was diagnosed with Lewy body dementia, give or take, but about 3 years ago.
And it's never easy.
It's been a tough journey, but we're doing it together.
Essentially, Alzheimer's is a disease of the brain. It robs memory, steals personality, and for many families and caregivers, it ravages their savings.
The financial implications to having a disease like Alzheimer's or dementia is it can really impact families for sure.
How prepared are people financially for the challenges of Alzheimer's?
You know, oftentimes people come in or call our helpline and they think that they're prepared, but in talking about it, really finding out that they're not.
The Alzheimer's Association estimates that a lifetime of cost of care for a person living with dementia is more than $250,000. The average out-of-pocket cost for health care and long-term care not covered by Medicare, Medicaid, and private insurance can exceed $10,000 a year.
I mean, this is so expensive, and that's why it is so important to consider these things early.
And why families need to plan. It's not easy, but as a wealth manager at RBC, Wally Chapman knows what people should think about. What kind of checklist should they have when they get a diagnosis?
You really have to act fast.
He says get in touch with your financial advisor right away, certainly your accountant. Check your health care coverage. Find out what's covered and what is not. Learn the difference between Medicare and Medicaid and what they will pay for, and look into long-term care insurance policies.
But it certainly helps the financial advisors, the accountants, those trusted advisors, those team members to know exactly what's going on so that you've got another line of defense that a mistake is not made by somebody that might not have the cognitive ability anymore to be making big financial decisions.
And just as important, let your loved one be a part of the decisions.
Hey, I found this home health agency that I would want to work with, or this is the care facility that I would want to go into. Again, involving the person with dementia as much as you can.
And when Wally Chapman's father was diagnosed, the Alzheimer's Association was there to help too.
They are and were my first call for help on what do we do? Where do we go? We needed a wheelchair. We needed a hospital bed at one point. We needed a walker. You know, they're helping us out with all this stuff, and it's just a fantastic organization.
It really is. This is Financial Awareness Month for the Alzheimer's Association. They have lots of tools on their website, including an online course on legal and financial planning. We put the link up on fox9.com. All right.